Hi, it's me. It's just me. It's just me. It's okay. I feel like I'm doing too much right now. Um, Welcome back to my channel. This is Charlene Sonia, Charlene Afrique. Welcome. Basically, is what nursing has taught me so far. I'm gonna start by telling you guys what I do at work, like as a home health nurse. As a home health nurse, I do CAT procedures, CAT procedure for bowel and urinary. Like basically, my job is to make sure that my patients doesn't have any leftover urine in the bladder, or that like her bowel or her colon is clear, like empty, because she tends to have, or she used to have, a lot of urinary retention and constipation. So basically we help like empty her bowels and her urine, so she doesn't have any like infection. You know how you can have a UTI if you have urinary retention. Yeah, even the bowel procedure helps against like a bowel ileus or shock, sepsis. We want to avoid her going back to the hospital. I also do like seizure precaution, medication administration. I call in meds. Like, let's say that if the meds are all finished, I will be the one to call the pharmacy for refills. What else? I check the treatment plan, even though I feel like the house manager is the one in charge of that, but I do look into. I also do call the doctor if something is not right. Let's say like the patient is all of a sudden not feeling okay, like completely different from the norm. I do a little bit of delegation. Like I work with what they call staff. They're similar to CNAs. I properly, like the right amount, not too much, because some of them have like GERD. Some of them have had surgeries where like they can't have like fatty, spicy type of foods or too much food, else they will bring it back up and it cause a lot of issues. We work as a team, in coordination as a team with like the house manager, the program director, other nurses, the doctors, and the staff. So yeah, you have to properly communicate with the staff, making sure that there's no like discrepancies, everything is done. And also it's important to communicate respect between the staff and the nurse. Also, I'm in charge of taking like doing the vitals, because it's COVID times. So I'm in charge of making sure that the patients do not have a fever or anything like that. So I'm always assessing the patients to make sure that the things that I've been learning at work, nursing, not at work, from being a nurse. Nursing is teaching me, because I'm not completely there yet. Nursing is teaching me to be present, fully present, zenning, like breathing. It's teaching me to be present, like here, like because I'm always like, okay, what's the next thing? What am I doing next? Like, am I making a mistake? So I'm always worried, especially since I'm a new nurse. I was worried that I was gonna hurt the patient. So I was so worried about that I was forgetting my patient. Like, I was always thinking, what am I doing next? Like, I kind of compared it to like being on a date. Like, what am I gonna say next? Guys, forgive me. My head is always like connecting dots. Let's stay on topic. But yeah, so it's teaching me to be present. And yeah, so not to forget your patient. Like, your patient is the main focus. Like with learning school, that's why when I'm understanding, I'm understanding why they say the patient is the center of the care. Like, so when you're doing your care, when you focus on the patient, let's say, I'm going to give you guys an example of how I didn't do that. Okay, for my procedures, doing the catheters, like emptying the bladder, I I have to focus on the, like, she has like a stoma, not like the ones that come out, but like it's inside, like an posterior stoma. So I literally had to put the cath in the hole, go in, make sure that the fluids don't like come off and like spill all over my face and stuff. And at the time I was new, so I didn't know like, botanics, but like, like how to hold, as nurses, it seems like sometimes you will need to have like 40 fingers. So like just how to hold stuff around and things. So I was so focused on that, and I was spilling, urine was spilling sometimes on the floor, sometimes the bowels were like kind of like spill out on the floor, and I would just freak out. I'll just start freaking out, like, oh my god, it's spilling, like, and then the patient is like feeling it too, like, what did you do? Are you killing me? Am I being killed right now? Like, so then like I remember one time the fluid literally like just not the fluid, the content from the stoma, from the bowel spilled out, and there was like not too much, there was poop a little bit on the I want to say it was, and I was so like, oh my god, I need to clean this, and then the patient looked, and she's not even like she has developmental disabilities, and she's not even sane, but she looked at me, she smiled, and she went like, me, what about me? So I'm like, oh my god, I'm so sorry, oh my god, I felt so bad. And it just brought me back to school when my professor was like, we're so focused on like what we're doing that we're forgetting to ask the patient like what's her name and stuff. But I didn't do it on purpose. Like, I'm a nice person and everything, but I was just so anxious, and I was just so worried about whatever was happening that I forgot that she was there. And then she was like, what about me? You didn't clean me up. So yeah, I was cleaning the floor. I'm sorry, guys. I needed to bring my water. I was cleaning the floor and everything, and I didn't clean her first. And that's one of the things I learned. Like, I learned to like focus on your patient. Like, you have to make sure that your patient is okay. Like, which is, I know, but trust me, if you're not used to just doing it, it doesn't come as second nature. Now I think about all of that when I do my care. I'm not completely there yet, but it takes time, So then, yeah, with time now, I learned to like, now I'm like conversing with her, like I talk about her, we talk, she likes Justin Bieber, so I talk about Justin Bieber and the fact that she loves it, and we talk about that while I'm inserting it, so she's not feeling like I'm actually doing a procedure. She feels like she's just on the toilet, and it really worked well. Like, and me too, it helps me like calm down and forget that I'm actually doing the procedure, and like so focus on like the procedure, and I'm with her. But it takes time. Like I said, now I'm getting more confident with the procedure. Like, I do it without having to like go through my notes, so I'm better able to like relax a little bit and focus on her, like her and like the process and everything, because it's not easy. This patient has to have this procedure every day for the rest of her life, and you have to also put that in mind. You have to make it as pleasurable as possible for her. So that's that for not forgetting your patient and being present in the moment with your patient. The other thing I want to touch upon is the fact that I notice patterns, and I used to just notice patterns with beats and rhythm, and I notice patterns, and I'm like, what am I gonna do with that? And then now I'm like, oh wow, now I can see how noticing patterns and concepts from what I was reading, like it relates to theories, is gonna help me like see, let's say like if I notice that my patient is usually like this, she's usually smiling, gullible and everything, and if all of a sudden she's, I notice that like she's, quiet and like, like think something is not right, and then this goes down to like trusting my intuition. There was a point where I didn't trust my own like intuition. Like now I'm tapping into like trusting myself, because I'll give you guys several examples. Like, even with the whole patterns, like I remember when I was at work at a facility, at one of the facilities, and one of the nurses was teaching me how to do the IV pump, how to use the IV pump. And this was the second time around. The first time I washed and she let me touch it. The second time she let me do it again, and then we both noticed that something was not right. but then we couldn't tell what it was. Me, I couldn't tell because it was just my second time doing it, but I noticed something was not right. So then we still did it, and she's like, I think it's fine. But then after I left, there was blood all over the floor. So then she had to call the doctor, and the doctor just said that she was just bleeding, and because there wasn't resistance from one of the little caps was not on there. Again, that's just one example. The other example is when I was doing my bowel procedure, like doing the enema, and I just noticed something wasn't right. I just saw the water was dripping a little bit, and I was just like, what is this? Like, it's kind of like plumbing, like fluid was leaking, and I'm like, something is not right. And then the patient was just looking at me like, uh-oh. So then I looked and saw it was not, there was a clear cap onto it, so I fixed it. So nursing is teaching me how to trust myself, my instincts, my like something is not right, and sometimes I noticed before all of this, I would notice that something wasn't right, but then I would just be like, it's whatever. But nursing is really teaching me to trust my intuition. I'm like, something is not right. If something is not right, call a second person, a seasoned nurse, or call the doctor, but go with a seasoned nurse. Then your has taught me is to be very flexible. Again, this is what it is teaching me, not what I have learned already. I'll give you guys an example. Like, I remember back when I was in nursing school, one of my professors was teaching me how to do finger sticks, and like finger sticks, like blood sugar. And there was an expectation for me, like I would come in, do the finger stick, like we regularly do, put the thing on there, and then boom, get the blood sugar. And as soon as I pricked her, she yelled. I freaked out so bad. Like, I'm like, oh my God, what just happened? Like, I was just like shaky. I'm like, damn. And then my professor was like, you have to expect the worst. Like, you just never know what's gonna happen. She could yell, she could fall, she could scream, like water could fall. Just don't worry. Just go with the flow, But I freaked out. That was one example. The other example is at work, there was this client. She usually stands up to get her weight, and then this time around she's like, she wants to stay on the wheelchair. And I'm like, but how am I supposed to get your weight if you're on the wheelchair? I don't know how much the wheelchair weighs. So I started like just worrying, like, what am I gonna do? My preceptor was like, don't worry about it. We're just gonna like have the PT. When they're getting her off the chair, you're gonna run and get the chair, weigh it, and then later bring her to the. Now they are in the other room talking. My dad is in the other room. So that's what it is. So and then even one of the clients that peed on the floor. So it's teaching me to be flexible. Like, it's okay if it doesn't work this way, we're gonna do it the other way. And before all of this too, my plan before nursing school was just to go through Regis and go through and do the ABSN program. I was so stuck on that. I'm like, I'm gonna do this is how I'm gonna do it. I'm gonna save money, I'm gonna go to that school. God was like, no, you are not going to that school, you're not going to any ABSN program. And I had to go through a totally different route to get to where I needed to get to, or to go to where I need to go to. So that is to say, like, if this person is not okay with you, that other person is going to be okay with you. If that thing doesn't work for you, that other thing could work for you. If so good. But me, I was like, this is what I want, this is what I'm getting, this is what I want, this is what I'm getting. But that's not how life works. We have to try different things and see what works for you. So it's not always a straight path, not always a traditional path. You might have to go through the back door or the front door or through the stairs or through the window. This video, like, comment, subscribe, because when you comment, it encourages me to do more videos. When you subscribe, it gives me Charlene Lafri, Charlene Sonia. Thank you. Bye. Oh my god.